Hello, welcome to JNO Live. I'm Seth Kruger, digital media editor at JAMA Network Open. Of course, if you're following live, send us your questions or comments on Twitter at JAMA Network Open or in Facebook Live or YouTube in the comment box. Today, we are talking about public concern about violence, firearms, and the COVID-19 pandemic in California. We have first author, Dr. Kravitz-Wertz with us. Welcome.
Thank you. Nice to be here.
Yeah, really glad you could join us. This is an interesting topic. I think some of the I think knock-on effects from the pandemic can be pretty interesting to me. So, if you can start, just tell our viewers who you are, what kind of work you do, and why you did the study.
Sure. So I'm Nicole Kravitz-Wertz. I'm an assistant professor with the Violence Prevention Research Program at the University of California, Davis. My research broadly focuses on the social and policy determinants of health and health inequity over the life course and across generations, with a particular emphasis on chronically rooted or structurally rooted chronic stressors in neighborhood context. Recently, that has focused more on community violence and other related health outcomes. So one line of that work is focused on collecting primary data to better understand the lived experience of violence in the lives of individuals and broader communities, which led in part to this work here in this study.
Great, really interesting. Unfortunately, the pandemic has been a bit of a kind of new chronic stressor now for a lot of people. So I think we're seeing a bit of these effects now. So tell us what you did in the study and what you found.
Sure. So we, for the past 2.5 years now, have been conducting a regular survey research project here in California called the California Safety and Wellbeing Study. Our first wave of data collection was back in 2018. That was really focused on determining the prevalence of firearm ownership in California. Those numbers hadn't been collected in the state, or really any other state in the country, for 40 plus years. And so that was really exciting the first year we got that out. We're planning to do our second wave of data collection in 2020. We had almost essentially completed our survey instrument when COVID-19 hit. And we had to quickly retool, or we saw an opportunity to quickly retool the instrument to gather information that might help us understand the intersection between COVID-19 and the lived experience of violence. So that was sort of the motivation here.
Yeah, it's really interesting. And, I'm, not an expert in all the data here, but from what I've seen in most news reports and some data in the last year or so, is during the pandemic, we've certainly seen what looks like an uptick in some gun violence. So this certainly seems relevant. So what did you find?
Yeah, so one of the things we saw really early on, even in the pandemic, was at least anecdotal reports of an increase in firearm purchasing. But there wasn't really a lot of hard data. So we surveyed a representative sample of California adults. And then for the subgroup of current firearm owners in that sample, we asked them whether they had purchased a firearm in response to the pandemic. We also asked the full group of respondents about their concern or worry about violence for themselves, concern about violence happening to others that they know, as well as experiences of unfair treatment, and again, for the firearm owners, about any changes in firearm storage practices. So in general, we found an uptick or an increase in the percentage of individuals who were worried about violence happening to themselves during versus before the pandemic. This was true across multiple forms of interpersonal violence, as well as self-harm and unintentional shootings. What we interestingly found was that there was a decrease in worry about mass shootings and exposure to mass shootings. So that was one element of our findings. We also found that there was a significant share of our sample that were concerned about someone they know physically harming themselves or someone else. And for the people who are concerned about someone they know harming themselves, a good share of those, or at least a non-trivial share of those individuals, were concerned about that person because they had suffered a pandemic-related loss. So either loss of a loved one due to COVID-19, loss of housing or a job or something similar. And then on the firearm acquisition side, we found that I guess when we extrapolated our findings to the population of California, we found that approximately 110,000 adults reported that they had acquired a firearm in response to the pandemic, including about 47,000 who said they didn't already own a firearm. And finally, then on the storage side, we found that, again, extrapolating our findings to the population, we found that approximately 55,000 people had adopted the least secure storage practice. So that's loaded and not locked up in response to the pandemic.
Yeah. Wow. So a lot there to unpack. That was a great summary. Thank you. But yeah, I mean, again, I think one of the strange silver linings is that the concern for mass shootings has been lower from the pandemic or during the pandemic. This has been, it's been what, 10 months now, and it's just so surreal. But again, one of the small silver lines we've seen is just fewer mass shootings overall, and less concern about mass shootings. But of course, more concern as you report here for robberies or being shot by a stray bullet or something like that, which is really fascinating to me. And then also.
I was going to touch real quickly on the mass shooting point. There's various definitions of mass shootings, right? And so there's been some recent discussion around how we potentially aren't seeing a decrease in mass shootings if we define mass shootings as 4 or more individuals who are injured, maybe rather than killed. We typically think of mass shootings potentially as like things in Las Vegas or Sandy Hook. But if we think about mass shootings as encompassing more interpersonal community gun violence, we have seen huge upticks there.
Yeah, that's one of those things where I always promise this is not a journal club, but the analogy to me is always when we talk about like frequent users of emergency departments, the ways you can define it are often very hard to capture in a way that kind of jives with what we think of as the thing. And there's, if you try to define it as the, I don't know, common conception, it's really difficult either to pull it from a data set or to get a definition that kind of captures, what random person on the street thinks of as a mass shooting, or I don't know what a random emergency department clinician thinks of as a frequent utilizer, and it's just tough. It's one of the challenges you deal with in making these definitions.
For sure.
So it's very hard. Moving on, the self-harm is, I think, one of those things that can easily also get lost in the firearm access and firearm safety discussions, and that what is something like in general 2/3 of firearm deaths are self-harm or suicide, and it's 13%. About 1 in 8 people are concerned that someone they know is going to commit self-harm, especially in the context of, as you mentioned, the 47,000 new firearm owners in the pandemic, and the obvious pandemic stressors is certainly concerning.
Absolutely. Yeah. Like you said, 2/3 of firearm violence is firearm suicide. And one of the sort of things we were interested in capturing with this survey broadly was this idea that violence really touches the lives of far more people than we typically recognize. So here, even when we're talking about concern for others, we see these huge numbers when we extrapolate to the population, huge numbers of people who are concerned about someone they know harming themselves. I think it's, it's something like an estimated 4 million people in the state who say they were concerned about someone else harming themselves. And then of those, something like 300,000 who were concerned because of, something related to the pandemic. And with the increase in firearm prevalence potentially in the home, we know from past research that firearm ownership, and in particular, easy access to unsecured firearms in the home elevates the risk for firearm-related harm for everyone in that home. And that's particularly true not only when it comes to unintentional shootings, but also for completed suicide.
Yeah, and as 2020 was a complex year, one of the things that happened alongside the pandemic was some of the marches and protests from the George Floyd and other unarmed black people shootings. Were you able to capture any of that in your survey? And the concern for people, you do have 3/4 of the reasons for acquisition were lawlessness, potentially, but was that able to specifically capture any concerns about riots or things like that at all?
Yeah, we weren't able to capture that directly. Potentially, some of the motivation for firearm acquisition, particularly for those who mentioned lawlessness, might be tied up with that. As you know, and as we sort of say in the paper, the overwhelming majority of protests against police violence and for greater accountability were peaceful. So we always like to underscore that point. We did ask about police violence and concern about violence for oneself in relation to police violence. And, we saw, I don't have the numbers offhand, but, pretty significant, over half of respondents indicating some concern there about police violence more generally, and upticks, some of the larger upticks in concern during the pandemic related to police violence.
Interesting. Thank you. To change things, pivot to a bit of a good note, it looks like about 10% of the new firearm acquisitions were for hunting and sport shooting, which frankly struck me, I'm not a hunter nor a sport shooter, but struck me as, if done properly, safe, socially distant ways to entertain yourself during a pandemic. So that does seem a little bit optimistic, which is nice.
Yeah, potentially, assuming that those firearms are stored securely in the home and not accessible to sort of vulnerable people living there, then potentially.
Right. Excellent point. The potentially is important, I think. All right. So any other points you want to add before we finish up today?
No, I think I would just underscore some of maybe the larger implications of this work, and maybe just highlight some of the short-term prevention strategies that we also point to in the paper. So here I would just underscore temporary firearm storage outside the home for people who may be struggling or in acute crises. Similarly, extreme risk protection orders, or what in California we call gun violence restraining orders, but then also community-based violence intervention and interrupter workers, I think, are particularly key in these times of broader societal stress.
Yep, really excellent points. Again, I mean, we've talked about firearm violence and violence prevention on the show here before, but I think some of the key points, like we mentioned, is that about 2/3 of firearm deaths are from suicide. Access to firearms in the home, especially unsecured, is one of the big risk factors, which is really unfortunate that the data show that there's more unsecured new firearms in the home now. But it's small things we can do to make people safer. So thank you so much. This is really important work, and thank you so much for coming on the show today.
Thank you so much, too.
Great. Of course, you can get this article and more at JAMAnetworkopen.com, where everything is free and open access. We have new papers coming out every day at 10 a.m. Central Time, every weekday, and of course, join us again next week, January 12th, Tuesday at 3 p.m. Central Time, again for JANO Live. So take care and stay safe.